Thousands of refugees will soon begin arriving in cities throughout Canada. Some of them have spent years in refugee camps, living in close quarters with limited access to health care. That raises the question about the preparedness of Canadian doctors to tackle their medical needs. Dr. Jolene Huber is a physician and works at St. Michael's Hospital in the Inner City Health Clinic in Toronto, and she joins me live in studio. Thank you so much for joining us here early on a Sunday.
My pleasure.
So, what are some of the challenges that medical personnel are going to be faced with expected 25,000 over the next few months?
Right. So I was just speaking this week with a doctor in Lebanon who's working with the Syrian refugees, and he actually told me that a lot of the health issues are similar to what we see here in a family medicine or pediatric practice. They're just compounded by the fact that many have been living, as you mentioned, in crowded housing, so infections that perpetuate in those kind of situations, or not access to water or good sanitation. So sometimes it's hard to treat infections when you don't have good sanitation. Things like nutrition, he said, are a big issue. So food scarcity, not having gas to cook your meals with, not having fridges to store your food, and so often they're buying street food to eat on the spot, and it may not be always the healthiest, access to fruits and vegetables. So nutrition is a big issue. And then he said, of course, just like here, mental health is an issue, and even much more compounded because they're coming from situations of war and violence.
Okay, so there's a lot to unpack there. Let's walk through some of those topics.
Sure.
So in essence, we're talking about people arriving with healthcare concerns that are, if not unheard of, rare in this country, right? Some of these illnesses.
Sometimes it's a case of medical conditions that we don't see, but I think even more so of a big issue is chronic conditions that are not being treated or haven't been treated, sometimes for up to 4 years. So things like diabetes and not having access to medications to treat that. The doctor I was speaking to in Lebanon this week said he has a 12-year-old girl that he's working with that has a foot ulcer, and that's turned into an osteomyelitis, which is a bone infection. And usually that would be treated in the hospital with antibiotics, and they can't access that. So it's these chronic conditions that we have here, even like high blood pressure, but without access to good care. So that's going to be a big priority when patients come here, that we start to actively treat those conditions.
Now, as you mentioned, there are doctors, they have had some kind of treatment, they have had examination there on the ground, at least in the UN-run camps.
Right.
But yet, when they arrive in this country, what is the sort of triage effect of your medical personnel? What do you deal with right away?
Right, so right away when they first arrive, it's doing a physical exam and a history and looking for acute infections.
Because you don't have a history, right? It's not like your family GP where they can pull out the whole history of medications and illnesses, right? You're starting from really ground zero, aren't you?
Starting from scratch. So the same if we saw a new patient here or any newcomer to Canada, you're starting from scratch. You often will need to have an interpreter to try to get the best history that you can, do a good physical examination to try to figure out what are their main issues. But sometimes it's blood work and investigations that also gives us a clue into their nutritional status or their health status. And so those will be really important. When you mentioned infection, and some of those are the first things that we look at. Also immunization. So there is an immunization program in Syria, but it's been interrupted or disrupted for many refugee children because of the war. And so when they come here, we want to make sure that we can get them up to date with their immunizations right away.
Now, there has been a certain amount of fear-mongering, much of it without any basis about what people are going to bring here. But are there some concerns about infectious diseases that you have to look out for?
Yeah, I think whenever a newcomer comes to Canada, or when any of us travel outside of Canada and come back, there's always that risk. So doctors are mobilizing. Public health has been very aware of this, and there will be screenings when people first arrive for some of the big infections that we know that we can treat right away and get those under control. So that's one of the things that we'll be looking for, and I don't anticipate it should be a big issue because we're very aware of that.
So much of this we've been talking about is their physical health. Now, their mental health. My mother taught in schools for years where children would come from the first Afghanistan war against the Russians, and a child would sit under his or her desk for an entire year. They were so traumatized. People have seen, literally, relatives die, and then they have been in camps. So how do you deal with the mental PTSD, obviously, we're talking about here, aren't we?
Right. Usually when refugees or newcomers first come to Canada, they're just so excited to be here, and they really want to get a roof over their head and shelter and food. But as the weeks progress and the months progress, we do start to see some of those symptoms of PTSD and mental health issues come out, and that's an important role that the doctor has, and as you mentioned, the teachers in the school have to really be watching for those kinds of symptoms and getting the treatment and the help. We have lots of psychiatrists and centers in Canada that deal with those kind of things, so identifying those issues early and getting them help. But a big part of adjustment for mental health is integrating into community. So being welcomed by Canadians. We know that when children have a safe and secure attachment, friends and teachers that pour into their lives, so getting involved into a school and a community for the family really can impact their mental health and well-being right off the bat, and that's a really important thing as well.
So that mental health aspect, that treatment goes, that's everywhere from teachers, you mentioned, the police, community groups, the Girl Guides, you name it, right?
All of us, and even if you're a parent in the schoolyard or your next door neighbor moves in and they're from Syria, it's for all of us to be welcoming and befriending and helping them integrate into community and to adapt here, and that helps mental health and well-being.
Dr. Huber, thank you so much. I hope to hear from you again as this process unfolds.
Thank you for
Appreciate
having
it.
me.
Cheers. Dr. Jolene Huber is a physician at St. Michael's Hospital in Inner City Health Clinic here in Toronto.